VGK 101 presents Hello, Knowledge Champions. Do you want to be treated based on your symptoms, or would you prefer for your symptoms to never appear because your doctor addressed the root cause? Conventional medicine focuses on diagnosing and treating diseases with drugs and procedures, while holistic medicine looks at the whole person, mind, body, and lifestyle. In this tutorial, we'll break down the key differences, benefits, and when to choose one over the other. Whether you're curious about natural healing or wondering how both approaches can work together, this is for you. Imagine we have two patients here who both have elevated blood pressure and decided to seek a doctor. Let's name the first patient John and the second patient David. John went to a conventional doctor, while David visited a holistic doctor as referred by a friend.
Patient 1. John visits a conventional doctor known as cardiologist. Initial assessment. The doctor measures blood pressure of John and the reading is 150/90. The doctor uses a stethoscope to listen to heart sounds. Findings: normal S1 and S2 heart sounds. No murmurs, rubs, or gallops.
By the way, doctors don't just place the stethoscope on your chest randomly. They follow a specific pattern to listen to different points. By analyzing heart sounds along with laboratory tests like lipid profile and kidney function test, blood pressure readings, and ECG results if necessary, they can determine which medications to prescribe after making a diagnosis. Treatment plan: amlodipine, 5 mg once daily to lower blood pressure. Amlodipine is commonly prescribed to a person with high blood pressure but a normal heart sound. It is a calcium channel blocker. In the heart and blood vessels, calcium channels help regulate muscle contraction. In the heart and blood vessels, calcium channels help regulate muscle contraction. Medications like amlodipine block these channels, reducing calcium entry into muscle cells of the heart and blood vessels. This results in relaxing blood vessels, reducing heart workload, lessening strain on the heart, and reducing blood pressure. Doctor's advice: reduce salt intake, exercise, manage stress. Follow up in 4 weeks to monitor BP and medication effects. Outcome: blood pressure may reduce quickly, but the patient is likely to be dependent on medication long-term. Now, David, the second patient, visits a holistic doctor. Initial assessment: blood pressure measured 150/90 with a normal heart sound. This suggests no major heart disease. If there's an extra sound like S3 or S4, it might suggest stiffening arteries or early heart disease, leading the holistic doctor to investigate nutritional deficiencies or stress factors. Holistic doctor investigation. Dietary habits. Does David consume a lot of processed food, refined sugar, and carbs? Emotional and stress levels. Does he experience anxiety or work-related stress? Lifestyle factors. The holistic doctor will also assess sleep quality, exercise habits, toxin exposure, smoking, and alcohol consumption. If patient David's findings are similar to patient John's, showing high blood pressure with a normal heart sound, no diabetes or kidney disease, and no history of smoking or alcohol, the doctor may prescribe amlodipine 5 mg once daily. However, David will be asked to track his blood pressure daily and submit the readings to the holistic doctor after 2 weeks. The holistic doctor will advise him to take ashwagandha, vitamin K2, moringa powder, eat whole foods and vegetables, sleep 6 to 8 hours per night, and engage in walking or exercise at least 3 times a week if possible. If patient David's blood pressure becomes stably normal after 2 weeks, the holistic doctor may reduce the amlodipine dosage or advise taking it every other day, with a follow-up in another 2 weeks. If David's BP remains stable after those 2 weeks, the holistic doctor may discontinue amlodipine. The doctor will instruct David to continue herbal supplements, healthy eating, and lifestyle, and schedule a follow-up after 1 month. If David's BP remains normal without amlodipine for 1 month, it indicates that he is managing well without hypertensive medication. If you notice, the holistic doctor did not forbid David from eating less salt because, as holistic advocates, we know that a lack of vegetables in the diet is the main reason for high sodium levels. Only the potassium from green leafy vegetables can lower sodium. Low potassium levels can lead to increased sodium retention. You may also try Googling the sodium-potassium pump for more information on this topic. Now let's tackle how herbal supplements make a huge impact on high blood pressure. Let's start with moringa powder. Moringa powder contains 7 beneficial nutrients for the heart and blood vessels. To keep this video short, let's focus on the 3 most important nutrients for vascular health. Moringa acts as a precursor for nitric oxide, helping blood vessels relax. The magnesium in moringa serves as a natural calcium channel blocker, preventing excessive calcium influx into blood vessels and reducing contraction. Moringa is also rich in potassium, which helps lower sodium levels. When sodium levels are controlled, blood volume decreases, reducing the heart's workload. Next is ashwagandha. Ashwagandha is known as an ancient and potent herb. It regulates cortisol production via the hypothalamic pituitary adrenal axis. Ashwagandha lowers sympathetic nervous system activity. High cortisol triggers the fight or flight response, leading to vasoconstriction. By reducing cortisol, ashwagandha relaxes blood vessels and improves circulation. Like moringa, ashwagandha also improves nitric oxide production. Nitric oxide dilates blood vessels, reducing blood pressure. Next is vitamin K2. Modern meat, poultry, and eggs are mostly grain-fed. Only grass-fed animals produce vitamin K2, as well as fermented foods, mainly the Japanese fermented soybeans known as natto. Vitamin D helps absorb calcium, while vitamin K2 directs calcium into the bones. Without vitamin K2, calcium remains in the bloodstream and deposits in soft tissues like blood vessels. It can also accumulate in the eyes, causing cataracts in the joints, leading to arthritis, or in the kidneys, forming kidney stones when it binds to other minerals and acids. When calcium builds up in the arterial walls, it makes them stiff and less elastic, leading to high blood pressure and an increased risk of heart disease. The conventional doctor treats high blood pressure as a disease and prescribes amlodipine right away. The holistic doctor treats the patient as a whole, trying to eliminate the cause before considering medication. This shows how heart sounds can be a diagnostic clue in both approaches, but holistic medicine aims for prevention and long-term health rather than just symptom control. In this video, I believe you already have an idea that people get sick mainly due to modern diets, lifestyle choices, lack of sleep, and work-related stress. VGK is not against conventional medicine. In fact, if you're familiar with Dr. Jamnadas, a cardiologist, he is a conventional doctor who advises his patients to practice fasting and eat whole foods. It depends on the doctor's beliefs, not just their medical practice. Stay tuned for my future uploads, where I will expand your knowledge just like a PhD doctor would. Always remember that VGK is here to expand your knowledge, because knowledge is not just power, but progress. Please subscribe, follow, like, and share. Thank you.